101.1. It's time to meet the doctor from the IRMC Physician Group as Annie trips over and falls over our equipment here in the room. She might need a primary care physician after this to check out that ankle she just broke, huh?
She might.
Dr. Timothy Wong is with us this morning. He is a primary care physician, and boy, is this an appropriate time to have you on the air with us. I imagine for a primary care physician, your office is pretty full right about now, isn't it?
Yes. Mostly there's a lot of colds and a few flu.
Mm-hmm.
So that keeps us busy trying to keep people as healthy as we can. A lot of annual wellness visits coming in because of the new year as well.
Oh, yeah, I would guess that, too. I hadn't even thought of that, but I was thinking primarily of the colds and the flu. And the stories that we're hearing now about how potent this year's flu is that's going around probably has a lot of people worried and asking questions. And that's where you come in, obviously. You can answer some of those questions, like, is it too late for a flu shot to have any effect on whether or not I get it?
I think that's a great question. A lot of news outlets are saying that the flu vaccine isn't very effective this year. I think people are saying about 10%, but it is never too late. And the recommendation by the CDC is that you can still get the flu. Last year, actually, the flu season was very late. We still had flu cases, I think, in May.
Mm-hmm.
So you definitely have a lot of time to still get it. And even though it might be only 10% effective, that can be a very big difference for a lot of people, especially with our vulnerable populations, such as pregnant women, children, and definitely the elderly.
Now, when people talk about the flu shot and its effectiveness, are they talking about just not getting the flu because you've had it, or the flu, when you do get it, lasting a shorter duration? Talk about what does it mean to be an effective flu shot?
I think it's that's a good question. I'm not 100% sure, but I think it's contracting the flu and getting the full symptoms.
Mm-hmm.
But even with the 10%, you do get some herd immunity, meaning that if those around you don't have the flu because of the flu vaccine, there is a beneficial effect. So it's most likely higher than 10%.
Yeah, that study that was released yesterday said that, we spend so much time trying to avoid sneezing and coughing and all of that. But the simple act of breathing when you have the flu sort of floods the air around you, and people could be vulnerable to the flu just because you're there when you have the flu. So obviously you have some recommendations for people when they get the flu, how they should treat and how they should relate to others.
Yeah, I think definitely the flu is airborne, so it can be very contagious. The big thing, too, is that a lot of people assume they have the flu if they have diarrhea, nausea, vomiting, but sometimes that isn't the full flu. There's thousands of cold viruses out there, and a lot of cold viruses are very flu-like.
Mm-hmm.
So when medical professionals talk about the flu, we really mean influenza. It is definitely cold season and also flu season, and it can be hard to differentiate the two. If there's any questions or you're concerned, you can always get tested. And at IPG, we actually have this new flu machine that's about 96-97% accurate.
Really?
So it's much more accurate than the rapid flu. And it's most important to get diagnosed within 72 hours so we can start Tamiflu for patients.
Uh-huh.
But generally, if it's beyond 72 hours, it can still be helpful for kind of the point you were alluding to, because people still can be very contagious. And if you do know it's the influenza flu, it's very important to make sure you're not around the vulnerable population around.
See, now I'm intrigued because you said this. You mentioned this machine that is available with the Indiana Physicians Group. Tell me about that machine. How does it work, and how can people have access to it?
It works by nasal swab. So our MAs or our LPNs will take a nasal sample from your nose. It's pretty far back, a little uncomfortable, up your nostril. And it takes about 20 minutes. It uses optical assay. So it's a new technology. It's not just looking at the rapid flu. And it's very accurate. It'll tell you if it's flu A or B, although it doesn't really make a difference in how you treat it. and it's much more accurate than the rapid flu, so it does have a lot of advantages.
Yeah, yeah. So for people to take advantage of that machine and being able to use it, IRMC Physician Group, of course, you guys have the machine. Is it just through your office or through IRMC Physician Group as a whole?
I think the primary care offices, most of them do have the machine. So if you are concerned, you can talk to the primary care office and see if the doctor wants to see you, or if you can come in just for a nurse visit to get checked for the flu. Those are always the two major options.
Now, the Indiana Regional Medical Center has a wonderful urgent care facility, two of them, as a matter of fact, on the main campus and IRMC at Chestnut Ridge. They have a tremendous emergency room as well. And what great assets, what wonderful things they are for IRMC to offer to our community. But even at that, the idea of actually having a primary care physician should be something that people explore, because then you're not coming in just when you're sick. Now you're talking about the entire health picture. Is that correct?
Yes, I think primary care doctors have such a large benefit to the community. I think there are many studies that actually show that if the quality of life improves with having a primary care doctor, you get increased diagnoses. You also have decreased healthcare costs in the community with more primary care doctors. So it actually improves the overall community health. Individually, primary care doctors can provide a lot of good benefits. So we can diagnose things early. I think that's one of the most important things. I think patients have to realize, and people have to realize, that diseases progress, and it's generally easier to treat when they're earlier, and even maybe when you don't even have symptoms. So, for example, I use diabetes a lot. You might not have any symptoms if you are diabetic until it gets really bad. So it's important that you see your primary care doctor, get your health maintenance done, make sure you don't have really bad diabetes, and if you do, get it treated before you actually have symptoms. Yeah. By then, it can be a little too late.
Yeah, and you said maintenance, and that is a key thing, isn't it? To have a regular schedule of doctor's appointments so that you can be sure that you're where you need to be physically.
Yes, I think a lot of patients actually come to my office and they tell me, oh, there's no reason I'd be here unless it's only because my wife told me to be here. And I would say, but...
Gee, you focused on the guys right away there, didn't you?
It's a trend. It's not a anecdotal trend, I see. But I asked them, too, do you, change your oil before the check oil light comes on? And a lot of them say yes. And I think it applies to the body, too. So you want to get your health maintenance done before something goes wrong, before your check engine light goes on,
there you go.
Before you need to take it to the garage because something's kind of falling off the car.
It's a good analogy. Before the breakdown occurs, might as well get that taken care of. Check the tires and the oil and the pressures and all of those wonderful things. Speaking of pressures, people in I don't know that it's just this region or Western Pennsylvania as a whole, but the problems of obesity and what they bring on. You mentioned diabetes, high blood pressure, all of these things. They can stack up within somebody who's not following a regular maintenance routine with their body, and that's what leads to the breakdown. That's, again, what a primary care physician is all about, isn't it?
Yeah, definitely. Obesity is actually a great example because it leads to so many other medical problems, like you just said. Obesity is correlated with diabetes, osteoarthritis of the knee, chronic back pain, heart disease, strokes, high blood pressure, sleep apnea, heartburn. So I could go on. So what part of the primary care doctor or the primary care provider's role would be to help with obesity before other problems occur from that problem.
So dietary changes, exercise, fitness routines, those sorts of things that people say, one day I'm going to do that. When they meet up with their primary care physician and he or she tells them, okay, this is where you're headed if you don't start doing it now, that forestalls all kinds of problems.
True. I think obesity is a large problem that does cause many other problems. You did mention kind of exercise as well. I think studies have shown that exercise doesn't really help with weight loss, actually. It's a common misconception. The most effective kind of strategy I found for patients to lose weight is actually decreasing carb intake.
Mm-hmm.
I usually recommend for my patients the MyPlate model, which you can go online. I think it's myplate.org. And it goes through kind of types of foods you should have. There's 3 main food groups: fruits and vegetables, meat and protein, and carbs. Mm-hmm. And that diet kind of model says to decrease your carbs to about 25%. And I found that about 80% of patients will improve greatly with just that dietary change.
The IRMC physician group, Dr. Timothy Wong, our guest this morning as we play Meet the Doctor with the doc, and working with the physician group and being able to draw upon the resources of knowing there are other primary care physicians, there are specialists in every discipline that you can think of. Must be a tremendous advantage to be affiliated with this group and be able to really team up on patients when problems occur.
Yes. I think a great example was actually Dr. Gaddy, the podiatrist, texted me this morning. I actually called him last week, and I had a gentleman who slammed his finger in the door. And I don't see too much of that. And I was wondering, what should I do? Should I take off the nail? Should I send him to someone? And Dr. Gaddy, who works with feet, it's a very similar case when you slam your foot in the door or have trauma to a toe. He told me, you really have to watch out for fractures. So I sent the patient to our orthopedic colleagues at IRMC. And actually that night, the patient was in surgery to fix a fracture. And then actually Dr. Gaddy just texted me this morning asking how he was doing, and I told him. So there's a lot of collaborative approach to that. So it's great. Sometimes I'll call dermatology, or actually last night I texted Dr. Bajwa, our pulmonologist, about a case.
Wow, that really brings it all home. It is a teamwork approach, isn't it?
Yes, it is. I don't think any doctor's an island. We do have to work together. And I think part of primary care is actually knowing your limits, so knowing when you need extra help.
So folks who want to set themselves up with a primary care physician, obviously IRMC Physician Group is a good way to go. What do they need to do in order to say they want to become one of your patients or one of your colleagues' patients?
Nothing really. I think we just need insurance information and, a telephone number. That's good.
Yeah.
And we also actually help people who don't have medical insurance. I have a lot of patients who I don't see for a year, and they come back and say, I didn't have insurance for a year. And I tell them, you know what? We have resources to help you with that. We have social workers who can help you get Medicaid or another insurance that we offer called Symetra. And so we can help patients who don't have insurance or are looking for insurance. So I don't want patients not to get primary care just because they have a lapse of insurance.
Very good. And you can hook up with the IRMC Physician Group. Annie, if you could jump on the mic there real quickly just to give us the telephone number for folks who want to know.
Yes, absolutely. It's 888-452-IRMC, or they can visit www.irmcdocs.org. We have all of our PCPs, all of our specialists listed online.
Wonderful, wonderful. Dr. Wong, thanks for coming in this morning. Appreciate it.
Thank you very much.
It is Indiana in the Morning. By the way, Dr. Kresge, also affiliated with the physician group, and he's got his New Year, minimally invasive cosmetic session going on tonight. That's at the Park Inn. It's at 6 o'clock. Live Botox demonstration, a part of this event tonight. You can call 888-452-IRMC or just walk in. They'd love to have you tonight. Dr. Kresge's a seminar that he's putting on at the Park Inn here in Indiana tonight. It is Indiana in the Morning here on AM 1160 WCCS and 101.1 FM. We're headed toward Fox News at the top of the hour. That's just moments away. Josh Whittison is in our newsroom. Jack Benedict will be coming by with sports. A lot of high school basketball to tell